As you reflect back on it, what's the story? How would you describe 2020 from your perspective?
I think for 2020 for us, especially at Covenant Health System, was around adaptation. Every day we came into work, it seemed like there was a new model by the CDC. It seemed like, the panels were changing, how we were going to do testing, what PPE was needed, how much PPE was needing, was constantly evolving. And we had to be on our toes. So we had to adapt every day. We had to make sure that our caregivers were taken care of and that they had the proper precautions that they had on the floor, make sure that they had all the equipment they really needed. We had to rework our entire hospital. I mean, you think we put in 123 negative pressure rooms just inside of our hospital to make sure that we could get patients taken care of and make sure that our caregivers are safe, as they walked into the rooms. The other biggest thing for me was resilience. I am amazed at the resilience of our healthcare workers.
And looking back the last 10 months, the impact, I think, on our staff, our hospital and medical staff has been tremendous. Seems like such a small word, but it's been tremendous across the board, but especially those who are at the bedside. It's tremendous in what they have endured, from day to day, the type of work, but they've also accomplished a great deal. I don't mean this in a trite way. This really is a battle. It's a battle that we've been waging for several months now, and the work is it's very intense. If you just watch it from a distance, it's quite intense. The weariness that builds and grows, what they call burnout, the weariness is pretty severe at times. And yet, at the end of the day, our staff come back every single day. They're very tenacious. They have a strong calling for what they're doing. They have a strong calling to protect and advocate and treat patients. And so, honestly, at the end of the day, it's an amazing thing to witness. I'm very grateful to each one of them. As an organization, as a healthcare system, I can honestly say I believe we are stronger because of this. I don't mean that in a trite way either. I really believe that's the way it is. When I think about the last 10 months, we've gone from a drive-up trailer to a medical tent to a vaccine clinic, and each one was set up in 5, 6, 7 days. And so what the words I might not have used as readily last year or in 2019, words like innovation and nimbleness, being nimble, rapid decision-making, rapid fire decision-making, those have been part and parcel of our daily life, for some time. So again, all that can happen. You can be nimble, you can be innovative if your staff are flexible and if they have a flexible mindset and heart for what they're doing. And so our medical staff and our hospital staff have been tremendously flexible as we have moved units, dedicated spaces to COVID back and forth from the clinic, to the ICU, from lab to housekeeping. They have been very flexible. And I would say probably the watchword of the day has been teamwork. I know that's just a word that's thrown out a lot, but it really has been manifested in a pretty remarkable way.
The pandemic pretty much called the question, so to speak. Talk a little bit about that and how it's changed the way you guys deliver healthcare.
And we really turned to what we had already established, foundations in telehealth, how we were able to pivot within 7 days. We went from 4 visits a week to 20 to 25. And then the next thing we knew, we were doing 300-400 telehealth visits a week across a very diverse area. Telehealth in ICU, telehealth in family care, telehealth in chronic medicine and dermatology, particularly in mental health. So that happened very quickly. In our research realm, we pivoted quickly, and suddenly we were using Zoom for key stakeholder meetings around research and really building a new paradigm of how we conducted research and brought researchers into the building. And then, of course, academically, luckily, we were able to continue to get all of our folks through their academic preparation. We did not have any students who had delayed graduation or delayed preparation with their theses and dissertation. And because we knew that we had a mission to get healthcare workers out in the field doing what they needed to do to provide care.
You talked about adaptation and resilience. How does that make you better going as an organization going forward?
When you have to adapt as much as we did in 2020, your administration team, your workforce has to be flexible every single day. Where we're moving patients, how we're treating patients, protocols that we're using. It was a really neat environment from that standpoint because everybody was really invested trying to figure out what is the best way to treat this virus panel. It was kind of a trial and error year of, how do we face and where do we look at from research studies and protocols and all those various things that you can possibly do to make sure that the people who are coming to see you get the absolute best care they possibly can with the most up-to-date research that's available out there.
This is a little bit more forward-looking, but give us the elevator speech on your vision for the Texas Tech University Health Science Center and how innovation plays into the way you educate, the way your faculty operates, and maybe into the ecosystem of Lubbock and the region.
So in September, we launched our new vision statement for the next decade, and it was to transform healthcare through innovation and collaboration. And what the pandemic taught us is that when we came together with both internal and external stakeholders, some individuals we had never worked with before, we were able to solve problems like we've never been able to solve problems and really serve the people of West Texas.
So absolutely, our frontline caregivers, our doctors were absolutely amazing through this. When you talk about our intensivists, our hospitalists, and really coming together and going, what are we collectively going to do to make sure we battle this? The infectious disease doctors that were there with us on a daily basis. I think there's a lot of unsung heroes.
And when we actually asked the question, in the hospital, which we make rounds, and we ask the question, who is a good team player? What is a good teamwork-oriented department in the hospital? And they start just spitting out name after name, department after department, because they were here when we needed them. They responded without complaining. They responded quickly. They got the job done. I mean, those are all manifestations of teamwork. And so it's something that also highlighted what I might call some unsung heroes in the hospital. When the facilities department comes up out of the basement to install a scrubber in a room so we can put a COVID patient in there for the right airflow, which we hadn't even thought of that a year ago. And they are really doing this routinely. When EVS comes in and uses a certain type of Clorox to speed the room cleaning and to do it in a way the patients feel confident with, and food nutrition brings up certain types of meals they can put through the door without going in the room, all these types of efforts, we didn't have to tell people, go make something happen. They simply did it and brought good results to us. And so I think teamwork happens because they are respecting the people at the bedside. Honestly, you might be 2 steps away from the bedside, you might be 2 buildings away. But at the end of the day, that's our core business. And as long as we are respecting what happens to the bedside, I think it opens up a good mindset for being a team player. And you think about nurses that were being redeployed from one area of the hospital to a totally different area. Now, they have a license and they're trained to do this, but they haven't done it. And they willingly went and did it. Well, that speaks to teamwork. That speaks strongly to teamwork, and patients are the benefit of that.
So for us, we really expanded the size of our teams. We realized that diverse perspectives was so important. So we went from having small teams of 6 or 9 people to very large teams. And what we learned from that, because we were communicating daily, we were meeting daily with bigger teams, we were able to get communication out much, much more rapidly, much more effectively, and we were able to get immediate reaction and response to needs of those that it would impact, our decisions would impact. So certainly our teams became much larger and much more diverse.
Well, I want to make sure that that I tell you guys, I think on behalf of all 270,000 Lovekites, and really more importantly, for an area of probably over 1 million that you serve. Thank you for the organizations that you lead, what you've done for your patients and their families, for your employees, to work together collaboratively with our community is something that I'll never forget. And it's really something I don't think you could even put in words how significant it is. So just thank you very much.